Hello friends! We're going to talk today about my doctor appointment, which was with a cardiologist yesterday. I wanted to share some myths that are out there that I trust my cardiologist with giving me the facts and not what, say, TikTok is saying or somebody who's not a nutritionist, physician, cardiologist. For example, number one myth: oatmeal isn't good for us anymore. What? All of a sudden, we're hearing that oatmeal's bad for us, that it's been processed. This is one of the worst things for us, but that is not true. My cardiologist yesterday said he starts his day every morning with overnight oats with cashews and fruit in there, and he uses oat milk. Okay, that's just what he uses, but that happens to be what I also eat every morning. Here we go. I did a video recently on overnight oats, and before that I didn't know how easy, how convenient it was, and I'm just so happy I do this now. These jars are amazing. You get 3 of them in a pack from Amazon. Before we jump into anything else, I want to say welcome here. My name is Lisa. I do videos about health topics, things of interest. It's trending right now. I also talk a lot about myths and facts and some other fun things thrown in there. So if that kind of thing or medical mishaps is something that you're interested in, please consider subscribing or click the like button below. That one is free. Subscribing is free too, and it really helps our channel. I'm trying hard to get my channel out there, but the way the algorithm is with YouTube, nobody is going to see it unless you interact and you subscribe and like. The other thing I wanted to mention before we go on is I'm thinking of all of you. I have many friends who are out there thinking of you in Florida, Georgia, North Carolina, and any area that is affected by the storms, the hurricanes, the tornadoes, the flooding, thinking about you. I'm far away from that. We get earthquakes where I'm at in the Pacific Northwest, and I have not been in a hurricane or tornado, although it's very frightening and very destructive. Why do I see a cardiologist? Oh, disclaimer, I have to say this, you know how it goes. I'm not a doctor. This is just information that is for me, that my cardiologist has recommended. He also, like I said, is busting a couple myths that I had on my list for him to answer for me that I wanted to know, because I'm seeing it over the internet all over the place. And the other thing is, not only is it just information that he feels is best for me, you would want to go to your cardiologist or your doctor, internal medicine doctor, NP, nurse practitioner, whoever you see, and get your information from them on what would be best for you. Why would I go see a cardiologist on a regular basis? I started years ago, probably 10 or 15 years ago maybe, and that's because heart disease is very rampant in my family on both sides. So my dad had heart disease in his 50s. He ended up getting a stent placed. The stent placement went wrong, and he had open heart surgery, had bypass surgery. It took him a long time to recover, a long time to get out of the ICU. Since that time, he had many other stents placed and had heart disease. And once you have heart disease, like my cardiologist said, you're just kind of chasing your tail, trying to keep up with that and not to progress further. My father progressed further, and he died in his 70s of what appeared to be a heart attack. But my stepmom didn't do an autopsy, so we don't really know, but that's what we think happened. My grandparents on my mother's side both had heart disease at an early age. They didn't have statins and certain blood pressure medications that we have today. They didn't know about diet and exercise the way we know about it today. My grandfather died, I believe, in his 40s, and my grandmother, I know for a fact when she died, and she was 54 years old. My sister, my oldest sister, was diagnosed with heart disease in her 50s, and she has since had at least 2 stents put in, I think maybe 3. And my mother has had a heart attack. She has stents in. She had her first, what she called a mild heart attack, in her 50s. My aunt also, her sister, had a blockage. Her symptoms were here in the jaw. My sister's symptoms were here in the jaw. And my aunt then went in her 60s and had open heart surgery, had bypass. So my sisters and I also, as well as the other relatives, all have experienced high cholesterol. Oh no, Wi-Fi disconnected. Well, let's hope that we're continuing on. So I had cholesterol at about age 30 that was over 300. And that's when I started statins. I've been on statins for a long time. And my sisters also, both of them are on statins. We don't have high blood pressure. The other relatives did, although I am on propranolol, which is a blood pressure medication, but I'm on it for migraines. So I guess if I went off it and it showed that my blood pressure was elevated over a period of time, then yes, I would be diagnosed with that. At this time, I'm not diagnosed with it. That is why my sisters and I have had cardiac workups with a cardiologist for many years. I chose this physician because he is the best in our region. He saved my mother's life. He did my mom's surgery. He is an interventional cardiologist, and my oldest sister also goes to him. So why not? Keep it in the family. He is an amazing human. I like him a lot. We have a good relationship, and I trust what he's telling me. I first started off by talking with him about the couple things that I have and what he felt about that. Any concern over the fact that I know I have an inverted T wave? My EKG shows an inverted T wave. I was told I have had that for many years. Is it really any concern? And he said, no, that's an abnormal finding, but it's the normal for you. Your normal is to have an inverted T wave. I asked him about the history of mitral valve regurgitation with my pregnancies. Since my pregnancies, I have not had any problems. I was followed with a cardiologist in my first pregnancy for this. It was pretty significant at that time, but resolved after that pregnancy. So he checked me for that. There is no mitral valve regurgitation. I do have what he could hear over on this side is he said, yep, I still hear a mild murmur, but that is all I hear. Everything else looks good. EKG looks good. Labs look good. Let's talk about you. Do you drink at all? No. Do you smoke? Have you ever smoked? No. Do you do drugs? No. It's just the way it's been. Plus the fact that it's the way I am, but also the fact that, do you really want a nurse taking care of you in the hospital who's, been on some things or has recreational enhancements happening and then they go to work? I mean, no, you don't want that nurse. We all got tested regularly with urine tests, and they didn't tell us. These were let's show up for work. Surprise, you've been selected to go do a urine drug test. So I couldn't risk my livelihood by doing anything like that. I also, that's not fair to patients, but also who wants to be hungover and go to work? That's not fun either. But okay, back to that. He stated from looking at all my labs and talking with me and assessing my activity level. Are you winded? Are you short of breath? Do you have any chest pain? When you do these things, I'm going to ask you about climbing 2 flights of stairs, running a little bit, walking 4 miles, just those sorts of questions. I don't have any problems. My problems are in my hips and hip surgeries, but I don't have problems exercising and experiencing any kind of pain or shortness of breath. So now that we got the basics taken care of, again, you would have to ask your own provider. This is my cardiologist just giving me suggestions for me. We went over what I had been doing. So the data years ago said that people who haven't had a heart attack or stroke, which I have not, but are at risk for having a heart attack or stroke higher than maybe others based on their genetics and family history and or age, diabetes, different risk factors. Those people were told to take a baby aspirin every day or low-dose aspirin. I did that for many years. And then I heard a few years back that I think it was from Dr. Sanjay Gupta, not the one on CNN, but the one from York. I listened to him talk. He's a cardiologist, and he explained about the recent study that showed baby aspirin or low-dose aspirin is not recommended anymore for people like me. It is perhaps recommended for a different category of people, but it's not recommended for people like me. There were 3 clinical trials that were done, and that is the consensus. It changed worldwide. So that's when I personally stopped. But my intention at that time, of course, was to go to back to my cardiologist. You shouldn't stop or start anything without talking to your doctor. But the pandemic was going on. The risk of bleeds was much higher. I'd already had a GI bleed many years back. So I thought, I'm going to stop it. And then I will talk with him about it when I see him at my next appointment. I now have seen this cardiologist yesterday, and he agreed, no, don't go back on low-dose aspirin. That is not recommended anymore. What is the thing that we have to watch out for the most. It's that we don't want to develop heart disease, because as he put it, once you have heart disease, you're just really chasing your tail trying to keep up with progression of that and complications of that. I don't want that. So the goal is, how do we keep me from having a diagnosis of heart disease like many others in my family at very young ages? So at this point, I don't have heart disease. And I don't want it. So I went in there with a list. This is my notes from yesterday when I went in to see him. I wanted to hear everything he had to say based on my labs, based on my EKG and so forth. And then I wanted to ask him a lot of questions that I've been hearing about, reading about, listening to, mainly on social media, and even from other physicians that aren't cardiologists, but maybe that one that's out there that's a psychiatrist who's suggesting that statins are the devil. So I just wanted to hear from him what is going on with all of this misinformation out there. What's the truth and what's not? Okay, starting with statins. Based on my information, what they're looking at with cardiovascular disease, of course, is please keep your blood pressure in check. Please keep your bad cholesterol in check. Know what your numbers are. And when I say in check too, and know what your numbers are, like, work on it and then go back and get a lab and compare and see where you're at, because there are numbers that you should be below this number in this area. Same with blood pressure. Remember how it used to be 120/80? It's not necessarily that anymore. You know, what do you consider diabetes? There is also now pre-diabetes. There isn't just the black and white. You can do something in that stage of pre-diabetes. Or as your blood pressure is starting to taper up, what can you do to help get your blood pressure down? Well, we all know about the whole salt thing, but there's many other things that you can do as well. Keep your salt down, keep that in check. What clogs our arteries the most? What's the biggest problem? Fat. Fat, consuming this is what is clogging our arteries. There are different types of plaque. He taught me a little bit about the different types of plaque, because I know that I already have some here. And so we went over that. He's not concerned about that. That came from a CT, how we discovered that. What about the supplements? Everybody's on the bandwagon about so many supplements. What do we really need to take to have an effect on our cardiovascular health? Is there anything that I should be taking that has a direct link to making sure that I don't develop heart disease or have a heart attack or stroke? And the answer is no. There is not a supplement that is shown that if you take this every single day, this is what's going to happen. It's going to be great, just take that every day. But we don't have that, or everybody would be taking this one particular supplement. What about the fish oil? He said, eat the fish. Don't just eat tuna, eat salmon, eat fish. You don't have to take a supplement. I told him I don't really like fish. I do love salmon, but I don't like fish. And he still said, if you want to take a fish oil supplement, take it. If you want to take any other supplements, take them. But there's nothing that is directly going to keep you from having heart disease. So what will keep me from having heart disease? Exercise. Do you have to be going on the treadmill and killing your knees and breaking your hips every single day? You do not have to do that. Any exercise is good. If you even have to just do a couple hours of housework, 1 hour of housework, just get your heart going, get your body moving. Don't be so hard on yourself. If all you can get in is a walk around the block, then that's all you can get in today. Moving your body is what's important, and progressing up so that you can exercise a little bit more and have a little better endurance. He said a research study was done, and those who are walkers live longer than those who are not walkers. So I'm a walker. I'm not at the gym. I am walking though, but there's always a lot of rain in the area that I live, and I'm going to look into not just the walking treadmill, but a better type of, I don't need the Peloton, but I do need something. So if you have any recommendations, please tell me. I want some kind of treadmill. I don't have a lot of room, but I need it and I'm going to use it. Not eating the trans fats, not eating fried food, eating more of the fruits and vegetables. Don't we all know this? This is still the baseline of all of it. Eating healthy, getting a little bit of exercise. Some exercise is better than none. And taking your medications. If it's a statin, if it's whatever your provider tells you to take or suggests for you to take for your health, that's what you would take. If you're diabetic and they say baby aspirin's good for you, then that's what is good for you. I'm not diabetic and I don't have high blood pressure. I'm on a statin, and he and I went over whether my statin needed to be adjusted because I've been on this atorvastatin 40 milligrams now for years and years and years. And I don't skip a day. Even if I'm in bed, I'm running back down the stairs and getting this because I don't take it right before bed because it causes insomnia for me, but I do take it every single evening after dinner. He looked at my labs and he said, your bad cholesterol is 109. I want that to be 100 or less. So that is my goal, and I'm going to get to that. Tightening up with the diet, exercising even more. I just need to get down 9 points or more because the new guidelines are that number, that your bad cholesterol number needs to be 100 or below. Again, mine is at 109. I said, well, does that mean we should perhaps change my statin? Should I be on a different one, a higher dose, add something to it? And he said, no, leave it the way it is. Everything else looks really good. It's working for you. You can do this. I can. And he gave me the push that I needed. I asked him about sugar because if you watch some of my other videos, you know that I like things that are sweet. I said, is dark chocolate as good as they say that it is for cardiovascular health? And he said yes. Back to some other really good things to eat that would help us would be getting in all our fruits, getting in all our vegetables, trying not to have seconds. Then we went over something called an ASCVD score. Then we went over this score, ASCVD score. And he said mine was 4.6. So for those of you out there who get a score from your cardiologist or you ask for a score and they do the calculations for you, I'd be interested in what yours is and share information about health and well-being. What are some things you do to keep your cholesterol where it should be and your blood pressure where it should be and as healthy as you can be? Okay, so my score is 4.6. He said that is in the low range for a immediate or years out, I think it's 5 years out, risk of a cardiovascular event, heart attack, stroke, heart disease. So he said 7.5 to 20 is a moderate risk, above 20, high risk. I'm in the 4.6. So he didn't go over what I would do for you here because I'm not here, but he said where you're at 4.6 is great. Again, everything we're doing is working. And the only thing I ask of you is to work on getting that bad cholesterol number down, 100 or below. Okay, lastly, let's go over some of this. This clinical trial is not, again, it's not me saying this. The clinical trials have been done. I would never tell you information that I could not back up. Every single one of my videos, if you open up further, click more, you're going to see in the description box resources, links, where I got my information. So where I got it at this time about why we don't take aspirin every single day is from Johns Hopkins and from UCLA. Okay, so more recently, 2 large clinical trials, it ended up being 3, comparing aspirin with placebo among people with known heart disease give even more reason to be cautious with an aspirin. The clinical trial is called the ARRIVE trial. The second one is called the ASPRE trial, A-S-P-R-E-E, ASPRE trial. I don't have the name of the third one. But again, people who have heart disease, who have diabetes, who have had a stroke or heart attack are, if advised by their doctor, are the ones who perhaps would be on the low dose aspirin a day. But what they used to do is put people like me on it. It's just good for you for prevention. But what they found, even if you have a family history and bad genetics of high cholesterol and everybody's dropping from heart attacks, you still are, it's not advised for you to be on an aspirin a day. It is not going to benefit you. But what it could do is cause a GI bleed or other bleeding issues. Johns Hopkins continues on, I still recommend, or this physician says, I still recommend aspirin for those with known heart disease or stroke, or for select individuals who might be at particularly high risk due to evidence of significant plaque in their arteries, if they are not at high risk for bleeding. If you've had a heart attack or stroke, there's no doubt that taking low-dose aspirin is beneficial, says Dr. Mikos. at Hopkins Medicine, Associate Director of Preventive Cardiology. But if you don't have heart disease, should you take it just in case? The answer is, for most individuals, probably not. In addition to relieving pain, lowering fever, and reducing inflammation, aspirin can prevent blood clots from forming. Blood clots, the leading cause of heart attacks and strokes, form when a plaque, which is cholesterol and other substances, deposited on the artery walls, rupture, and your body tries to contain the damage by creating a clot. When arteries are already narrowed by the buildup of this plaque, a clot can then fully or partially block a blood vessel and stop the flow of blood to the brain or heart. Stroke, heart attack. Taking a regular dose of aspirin diminishes the ability of your blood to clump together into clots by targeting the body's smallest blood cells called platelets. They bind together when they encounter damaged blood vessels. While aspirin's blood thinning quality can prevent heart attacks, it can also put you at higher risk for other harmful events, specifically bleeding. So who all is making this decision? The U.S. Preventive Services Task Force, which is a panel of physicians who review scientific research to develop guidelines to improve Americans' health. They published new recommendations in April, and I will get the exact date for you, advising against daily aspirin use for the prevention of cardiovascular disease in people age 60 and older. Taking baby aspirin has been routine for millions of Americans looking to prevent a heart attack or stroke. It concludes that there is no net benefit of taking aspirin for primary prevention of heart disease in those 60 and older. These updated recommendations, I'm now on UCLA. These updated recommendations are based on 3 recent randomized controlled trials finding that using aspirin for primary prevention of heart attack and stroke showed no meaningful benefits and instead a higher bleeding risk, especially for older adults. It's important to note, however, that this new advice applies only to the primary prevention in people without known cardiovascular disease. So in my family, my mother is on the aspirin, my aunt is on aspirin, my sister's on the aspirin. And that is because they have all had a cardiovascular event. They all have stents and or heart attacks. And my other sister and I are on the statin. We are not on aspirin anymore. I just wanted to share some of these little tidbits of information that might be helpful to you. Again, talk to your own provider or your cardiologist, your pulmonologist, whoever you see for these kinds of questions, and never change, alter, stop, or add any medication until you speak with your provider. If you like this kind of information, if you like medical facts and myths, different interesting topics on medicine and medical mishaps, then please consider subscribing, and thank you for watching.